We thank you, O God, for the gift of life. We want to thank you, O God, that we are clothed today and in our rightful mind. We want to thank you for providing for us and our families. Father, as we are gathered here today, we want to thank you for the facilitators. We want to thank you for the organizers. We want to thank you for all those who have responded to the invitation to be here today. And Father God, as we gather new information, God, I pray that we'll put it to use so that it will benefit not only us, but our clients and the whole ministry and the maternity fraternity as well. Father, remember those who are coming, bring them safely. And Father, at the end, we will not fail to give you praise or the glory and the honor, because you are indeed worthy. Father, in these mercies we ask, amen.
Amen. Please be seated. Honorable Sir Malwin Joseph, Minister of Health, Wellness, Environment, and Civil Service Affairs. Miss Stacy Gregg Page, Permanent Secretary, Ministry of Health, Wellness and the Environment, with responsibility for primary health care. Mr. Colin O'Keefe, Ministry of Health, Permanent Secretary in the Ministry of Health, Wellness and the Environment, with responsibility and direct responsibility to secondary and tertiary health care and environmental affairs. Dr. Kamara De Castro, Chief Medical Officer and Chair of the Midwifery Board. Ms. Jane Gibbons, Liaison Officer in Barbados and OECS, and also part of UNFPA. Now, sure, I did not see Ms. Andrew here yet, but I just want to recognize and acknowledge Dr. Shirley Curtis and Ms. Deborah Lewis. These two facilitators will be basically blazing us for the next 2 days in new knowledge and helping us to advance midwifery here in Antigua in terms of capacity building for our nurses. I also want to take umbrage of acknowledging Mrs. Eleanor Warner. She is one of the co-coordinators of the midwifery program here in Antigua. Want to also recognize all the senior leaders in their respective places, staff of the Ministry of Health, Wellness and the Environment, special invited guests, members of the media, ladies and gentlemen, good morning. Good morning. God has been good to us, so why are we so dead? Praise the Lord. Anyway, we are going to strengthen the quality midwifery education, and so for the next 2 days, we will be having this workshop. But in the moment, we'll be dealing with a short ceremony. And so we recognize that it is said that midwifery education is the bedrock for equipping midwives with appropriate competencies to provide high standards of safe, evidence-based care. So we are really happy to have with us, of course, the UNFPA, partnered with the Ministry of Health in Antigua and Barbuda, and of course bringing these two facilitators to organizing of this various topics for this opening ceremony and for this workshop. We are really grateful to have them with us. And so without any further ado, I want to invite Dr. Kamara De Castro to bring you the welcome remarks, and she will be about 5 minutes. Put your hands together and welcome Dr. Kamara De Castro.
Good morning all. Honorable Sir Malwin Joseph, Minister of Health, Wellness, the Environment and Civil Service Affairs. Mrs. Stacy Gregg Page, Permanent Secretary, Ministry of Health, Wellness, the Environment and Civil Service Affairs with responsibility for primary health care. Mr. Colin O'Keefe, Permanent Secretary of the Ministry of Health, Wellness, the Environment and Civil Service Affairs with direct responsibility for secondary and tertiary health care and environmental affairs. Mrs. Clarissa Christopher, Principal Nursing Officer Acting in the Ministry of Health, Wellness, the Environment and Civil Service Affairs. Ms. Andre Andrew, Country Coordination Officer, Office of the Resident Coordinator, United Nations, staff of the Ministry of Health, Wellness, the Environment, members of the Midwives Board of Antigua and Barbuda, specially invited guests, members of the media, ladies and gentlemen, good morning. Every woman and newborn deserves high-quality care that fosters a positive childbirth experience grounded in respect, dignity, and autonomy. This includes having a chosen companion present, receiving clear and empathetic communication from healthcare providers, accessing effective pain management options, and having the freedom to move and choose their birth position. Midwives play a vital role in delivering exceptional care, and their expertise is essential in all healthcare settings worldwide. The framework for action to strengthen midwifery education is a guide to develop high-quality, sustainable pre- and in-service midwifery education to save the lives of mothers and newborns. This was launched at the 72nd World Health Assembly in May 2019, and it has been developed by the World Health Organization, the United Nations Population Fund, the United Nations Children Fund, the International Confederation of Midwives, and includes a 7-step action plan for use by all stakeholders in maternal and newborn health. When midwives are educated to international standards and midwifery includes the provision of family planning, it could avert more than 80% of all maternal deaths, stillbirths, and neonatal deaths. 87% of services can be provided by midwives when educated to international standards. Achieving this impact also requires that midwives are licensed, regulated, fully integrated into health systems, and working in interprofessional teams. Antigua and Barbuda welcomes this stellar opportunity at this critical point of history when the advancement of the midwifery discipline is recognized globally and more so in the region of the Americas and the Caribbean. We welcome you today to this capacity building exercise for the quality of midwife education as a multidisciplinary approach within the primary healthcare sector and partnership for strategic plans to improve this service in our country. Thank you.
Thank you, Dr. De Castro, for those welcome remarks. We really welcome, and we want to welcome you too as the chair of the Midwifery Board at this time. I think it's the first time that we would have had, we are privileged to have 2 PSs at the same time, at the same head table, and we'll be speaking basically one after the other because they have different responsibilities. So it gives me pleasure to call the first PS to speak, and this PS is responsible for primary health care, and some of the midwives here today are from the district, the community health centers. So we put our hands together as we welcome Ms. Stacy Gregg Page to bring us the first remarks. And of course, she will be followed by Mr. Colin O'Keefe after she's finished, who will be responsible for the secondary care, and he will be more responsible for those nurses that are here from Celeste Bird Medical Center.
Thank you, Mrs. Christopher. Honorable Samuel Wynne Joseph, Minister of Health, Wellness, Environment, and Civil Service Affairs. Mr. Jane Gibbons, Liaison Officer, UNFPA, Barbados, and Eastern Caribbean. Ms. Andrew, Country Coordination Officer, Office of the Residence Coordinator, United Nations. Distinguished facilitators, Ms. Deborah Ann Lewis and Dr. Shirley Curtis. Mr. Colin O'Keefe, Permanent Secretary within the Ministry of Health, Wellness, Environment, and Civil Service Affairs. Dr. Camario De Castro, Chief Medical Officer and Chair of the Midwifery Board. Mrs. Clarissa Christopher, Principal Nursing Officer Acting, Ministry of Health, Wellness, Environment, and Civil Service Affairs, and Master of Ceremonies, other colleagues from the Ministry of Health, Mrs. Elnora Warner, esteemed midwifery educators and participants, specially invited guests, members of the media, ladies and gentlemen, good morning. It is a privilege to bring greetings on behalf of the Ministry of Health, Wellness, Environment, and Civil Service Affairs, and in particular from the Division of Primary Health Care. Today's workshop marks another important step in advancing Antigua and Barbuda's national agenda for maternal and child health, workforce development, and health system strengthening. This collaboration with the United Nations Population Fund and the Caribbean Regional Midwives Association builds on the momentum generated through the January 2023 Regional Policy Dialogue on Midwifery Education. At that meeting, CRMA and regional stakeholders, including the Ministry of Health, committed to working toward a unified regional curriculum consistent with the standards of International Confederation of Midwives. This current workshop represents a concrete step in fulfilling that commitment, moving from dialogue to implementation through the strengthening of educators' capacity. Within the framework of primary health care and our pursuit of universal health coverage, midwifery holds a strategic place. Our district midwives and hospital-based midwives are essential, not only to safe delivery, but also to help promotion, early detection of risk, and continuity of care for mothers and children. Their competence and confidence depend on the quality of education, mentorship, provide. This workshop therefore reflects a policy priority in the people who train and guide. And preceptors, we reinforce the foundations of quality, accountability in service delivery. These principles are embedded in the Sustainable Development Goals, particularly SDG 3, and well-being, which align closely with our national priority to reduce preventable and child mortality while building a resilient health and technical support. Together, we are the framework in which education and service delivery converge to produce measurable improvements in maternal and child health outcomes. We also recognize the leadership of the Midwifery Board, the Nursing Council, and the Antigua and Barbuda College of Advanced Studies for their role in maintaining standards and cultivating the next generation of professionals. As we engage over these 2 days, I encourage all participants to think beyond the workshop, to translate knowledge into policy, policy into practice, and practice into impact. Our shared goal is clear: a health system in which every mother, every child is nurtured, and every health care the highest standard. On behalf of Wellness and Civil Service Affairs, I thank the UNFPA and all partners for their continued collaboration and wish you a productive and inspiring workshop. Thank you.
Honorable Minister of Health, Wellness, the Environment and Civil Service Affairs, Sir Malvin Joseph, kindly allow me to accept the protocols already established. Ladies and gentlemen, good morning. Those of us who have had the blessing of living with a midwife, we know that without a shadow of doubt, the responsibility of the midwife is not just limited to the delivery of childbirth. Not just that component. For those of us who have had the privilege of living with a midwife, it is difficult not to observe the varying levels of comprehensive health care and support that these practitioners provide. Long before parturition, in addition to direct provision of health care, the midwife engages in educating the expectant mother and her extended family and friends sometimes, in strengthening capacity to get through what could be a challenging process of childbirth. Then after childbirth, the work of the midwife shifts to that important critical born care, where both mother and child have to be carefully assessed and addressed as they both recuperate. With all this, the midwife still engages other family members at any hour of the day and the night. Sometimes the midwife has to spend time to ensure a successful postpartum experience for mother as well as child, family members, and friends. Now imagine our midwives performing these special duties, responsibilities, and skills even better. Imagine the results. Imagine the positive far-reaching implications to mother, to child, to family members, to friends. Imagine the positive results to the healthcare system in Antigua and Barbuda and beyond. This workshop will directly lead towards improved performance of our midwives. This midwife capacity development workshop will add to the already vast capability of our midwives, as the training that they will be exposed to sharpens their skills and broadens their knowledge and extends their capacity to deliver ever increasingly improved healthcare and related guidance and therapy for clients as well as other associates. The ministry is quite proud, as was said by P.S. Greg Page, to be associated with UNFPA and allied organizations and partners in this timely, important development of our midwives. As such, this ministry joins with all stakeholders in and of the Ministry of Health, Wellness, the Environment, and Civil Service Affairs, and by extension, with all concerned beyond Antigua and Barbuda, and sincerely thank the UNFPA and allied development partners, facilitators, local stakeholders in this noble and necessary task of strengthening the capacity of our midwives. Ladies and gentlemen, please join me in commending our development partners, please. So, as we know, to whom much is given, more is required. Okay, add more here this morning. To whom much is given, more is required. Let's say it one more time. To whom much is given, more is required. With this in mind, as a result of the additional exposure that this training offers, we expect and anticipate more from our already skilled, gifted, qualified midwives. As a result of this training, we expect to experience improved clinical monitoring, better screening, and increased accuracy of results. As a result of this training, we expect to experience enhanced applications and refined processes during prenatal, parturition, and postnatal phases, all alongside a more comprehensive approach towards the conduct of related examinations and evaluations. As a result of this training, we expect to experience more collaboration among midwives, more related engagements with allied healthcare professionals and support staff, and more direct positive interaction and communication with patients, with their extended family members, and friends. Yes, as a result of this training, we expect that these and other boosts to Antigua and Barbuda's healthcare services will indeed be the result, because we all know that our midwives will deliver, as they have always positively delivered, even with less resources. As our midwives develop, Antigua and Barbuda automatically develops. So, in anticipation of such positive expansion and growth of our healthcare service and our nation and our region, ladies and gentlemen, please join me in commending our valuable midwives. As I wrap up, trying my best to maintain the 5-minute. Naturally and inevitably, such development will lead to continuously improved informed decision making and ultimately more dependable and reliable healthcare services with increasingly skilled and confident midwives, with increasingly rejuvenated patients, and with increasingly satisfied family members and friends. Thank you, ladies and gentlemen, for your kind attention. Thank you for the organizers who would have gifted me with this blessing to address you this morning. Be well, everyone.
Wow. You see how the PSs are strong in the Ministry of Health? First, you had the lady. Of course, PS Greg Page, and you know how strong she is. You have heard all the time. Now we have heard the second one. And so the minister should be happy. He has 2 strong PSs. Now you are charged wives, and you are saying that you expect more, much more. Now, I am going to say, from the ministry's end, we continue to support you in order for you to do what you have to do. Right? That's not in agreement, are you? Very well. Well, answer. You know, if you're not in agreement, it looks as if, well, no, what I'm saying is not true. But you have to say it. The minister is here. And what you don't have to work with, we will make sure that that comes on board so that you can be comfortable and be able to perform by the time you finish these things. We are going right with time. With any further ado, I just want and the liaison officer from Barbados and OECS of UNFPA, Ms. Jane Gibbons. We are to have her or her on the platform while we would have had our planning, basically strategies and everything. I'm now seeing her in person today, and she seemed to be a pleasant person. Put your hands together for Ms. Jane Gibbons.
Thank you. You're welcome. Good morning, everyone. Okay, so I like to go through the protocol list no matter where it falls on the agenda. Okay, so bear with me. Honorable Sir Maureen Joseph, Minister of Wellness and the Environment and Civil Service Affairs. Ms. Stacy Gregg Page, Permanent Secretary, Ministry of Health, Wellness and the Environment with responsibility for primary care. Want to switch? One moment. Thank you. Mr. Colin O'Keefe, Permanent Secretary, Ministry of Health, Wellness and the Environment with responsibility for secondary and tertiary healthcare and environmental affairs. Ms. Clarissa Christopher, our Chair and Principal Nursing Officer, Acting Ministry of Health, Wellness and the Environment. Dr. Camaria De Castro, Chief Medical Officer and Chair of the Midwifery Board. I would recognize Ms. Andrea Andrew in absentia, the Country Coordination Officer for United Nations here in Antigua. I recognize Ms. Eleanor Warner, senior leaders in the ministry, our esteemed facilitators, Ms. Deborah Lewis and Dr. Shirley Curtis, all staff, again, senior leaders in the ministry, specially invited guests, the representatives of the media, all participants. A very warm good morning to add to all of the good mornings you've heard already. And I am always happy to be in Antigua and Barbuda. I was asked yesterday if this was my first visit. I'm like, no. The person asked, how many times have you been here? I said, maybe about 30 or thereabouts. And I went on to say I've been coming here from 2001 when I was with UNICEF and, given a little bit of history. So I am always happy to be here and to work with dedicated professionals to achieve our shared goals. So on behalf of UNFPA, which is the United Nations Sexual and Reproductive Health Agency, allow me to recognize you for investing the time to be here for these 2 days, for this capacity strengthening workshop, because we recognize that you already bring so much to the table. Let us start with a simple truth. Midwives are at the heartbeat of our healthcare system. From that first flutter of pregnancy to the first cry of the newborn, midwives walk alongside families through some of life's most vulnerable and powerful moments. And P.S. O'Keefe went through, what the midwife does up to toddler stage and working with the community as well. So we have heard and we know, and you know better than me, that your role goes way beyond clinical care. You offer emotional support, mental health guidance, and often become trusted confidants, especially for young mothers who are navigating uncertainty. I was told about one midwife who has been serving her community for over 20 years. She's not just delivering babies, she's mentoring those teenage mothers, connecting families to social services, and even helping spot signs of domestic violence. That's the kind of impact we are seeking to strengthen over these next 2 days. Midwives are also advocates. They work across disciplines, linking patients to community resources and serving as a wellspring of knowledge. They're essential not just in hospitals, but in homes, clinics, and communities. The Caribbean's own response to the global state of the world's midwifery report reminds us that midwives are also central to achieving the Sustainable Development Goals, especially reducing maternal mortality and ending preventable deaths of newborns and children under 5. But it's not just about those health outcomes. Investing in a midwifery workforce, strengthens our economies. A well-supported midwifery workforce means fewer emergency interventions, healthier families, and more resilient communities. Back in 2021, the World Health Assembly urged countries to elevate midwifery leadership. That means giving midwives a seat at decision-making tables nationally and internationally. We've seen promising strides here in Antigua and Barbuda. We had the revision of the curriculum with the assistance of our facilitators here. We were here in December 2023 working with some of you in the room to revise that curriculum. And we have continued to strengthen our collaboration with the Ministry of Health and the Midwifery Board. But there's still more to do, and that is in part why we are here for today and tomorrow. UNFPA has also been working with Caribbean governments, particularly over the last 15 or so years, supporting midwifery workforces, and our focus includes advocating for investments in midwifery-led models of care, strengthening education and training as seen here, preparing midwives to deliver comprehensive sexual and reproductive health services, creating enabling environments with strong regulation, and amplifying the voices of midwives, including the young midwives, because we need to ensure that we always have people coming into the profession. We are very proud to partner with organizations such as PAHO World Health Organization and the Caribbean Regional Midwives Association and other local institutions here. But let us not forget the human side of this work. At the heart of every policy and training module is a relationship, that bond we reference between the midwife and the client, that bond that brings comfort, safety, and sometimes, as I mentioned, even protection. But we recognize that midwives are human beings and also face challenges. You're navigating the same social and economic pressures, climate disruptions based on climate change, mental health concerns as the rest of the community. And that's why we're not only investing in training, but also in your well-being, your mental health and well-being and mentorship. I'll just reference data quickly as the population fund, and we need to ensure we have data to ensure we have those strong, secure systems to understand better what your needs are, how the services are performing, and where the gaps exist. So UNFPA remains committed to working with governments, civil society, communities across the region. We believe in a future where every pregnancy should be safe, protected, and every delivery. So I want to thank you for being here, and you can count on UNFPA to continue collaborating with you to build the midwifery workforce in Antigua and Barbuda. Thank you so much.
Thank you, Ms. Thank you, Ms. Gibbons, for your presentation this morning, and it gives me much pleasure. And we will be having our featured address and, of course, the opening of our workshop. And to do that, there is no better person than the Honorable Sir Malwin Joseph, Minister of Health, Wellness and the Environment. Please welcome him.
Good morning. Are you hearing me clearly? Yes. It is with great pride and profound respect to all of you here this morning that I join you in this conference. I join you today at this opening of this competency-based education capacity building workshop for midwifery. And we gather not only to deliver a program, but to reaffirm our national commitment, a commitment to the health, safety, and well-being of every woman, every newborn in Antigua and Barbuda. We gather to celebrate the extraordinary work of midwives and educators whose dedication forms the backbone of maternal and child health in our nation. And I pause to sincerely recognize Mrs. Eleanor Warner, for her decades of service, and whose competence I quickly learned when I took up this office as minister. She was the first principal nursing officer at that time when I took up this office, and I must publicly say that she guided me well in the initial stages. Midwives occupy a unique place in our health system. They are present at some of life's most critical and intimate moments. When a child enters the world, when a mother is in labor, when families experience both joy and vulnerability, the midwife is not merely a health professional. He or she is a guardian of life, a counselor in times of need, and a symbol of care and compassion in the healthcare system. The State of the World's Midwifery Report in 2021 reminds us that investment in midwifery education and services saves lives. But the report also points out something equally important. These investments strengthen economies, communities, and societies. When midwives are well trained and supported, they not only improve maternal and newborn health outcomes, they contribute to national development. In our context, this is particularly important, and Antigua and Barbuda is a small state with limited resources, and yet we have consistently demonstrated that with commitment, collaboration, and innovation, we can achieve remarkable outcomes in health and human development. Today's workshop is a continuation of that commitment. We are not working in isolation. Across the Caribbean and Latin America countries, they face similar challenges. Strengthening midwifery education, updating curricula, ensuring accreditation, and enhancing educational capacity is an imperative. UNFPA LACROSS 2020 survey confirmed that these priorities are universal in our region. Our journey reflects continuous learning, adaptation, and innovation. This workshop over the next 2 days is to build on these successes by equipping our educators with the skills, tools, and confidence to train the next generation of midwives using competency-based education approaches. CBE is more than a teaching method. It is a philosophy that emphasizes that students can do with what they know rather than merely what they memorize. It prepares midwives to meet real-world challenges with skill, confidence, and compassion. As Minister of Health, I want to emphasize that this government fully recognizes the value of midwifery. Maternal and newborn health is a top priority, not only because it saves lives, because it is a cornerstone of national development, social equity, and human dignity. Our vision is clear. Every woman should have access to high-quality, safe, and compassionate care during pregnancy, childbirth, and postpartum period. Every newborn should have the best possible start in life, and every midwife should be empowered, supported, and respected in her role. We also recognize that achieving these goals requires more than training programs. It requires investment in human resources, strengthening of regulatory frameworks, and creation of an environment that allows midwives to work to the full extent of their education and skills. This workshop represents a critical step in that direction. It empowers educators, who in turn shape the future midwives of our nation. It strengthens institutions, supports quality assurance, and ensures that our health workforce is aligned with international standards such as the ICM Essential Competencies 2019. Let us take a moment to acknowledge our partners who make this work possible. UNFPA has been a steadfast supporter of midwifery education in the Caribbean, and I would wish for you to recognize that. Their technical expertise, resources, and guidance have enabled countries like ours to strengthen systems, improve curricula, and expand capacity. The Caribbean Regional Midwives Association brings invaluable regional experience and insight, helping us adapt to global best practices in our local context. And of course, I wish to recognize the facilitators and resource persons who will lead this workshop. Your education, knowledge, and mentorship are critical to its success. To the midwifery educators present here today, you are the backbone of this initiative. You hold the responsibility, privilege, and honor of shaping the next generation of midwives. What you teach, how you mentor, and the example you set will directly impact maternal and newborn outcomes across our nation. As you embark on these 2 days of learning, discussion, and practical exercises, I urge each of you to, 1, engage fully and share your experiences with your colleagues, and do so with vigor. Embrace new approaches and think creatively about applying them in your classrooms and clinical settings. Consider how the skills you gain here will translate into better care for every mother, every newborn, and every family in Antigua and Barbuda. Before I give my few closing remarks in terms of the end of my presentation, I wish for you to reflect on the fact that in Exodus, in the Bible, it speaks about midwives. And there was a particular passage that revealed that at one point, when Pharaoh wanted to dictate the affairs of the midwives as they were taught to execute their duties, they stood firm against the authorities. I think you should give that applause. They stood firm against the authorities, and rather than slaughtering the Hebrew children, Hebrew babies, they did what they were supposed to do: cut the umbilical cord and bathe the babies. So your legacy of rich service to nation building continues today. And I am very pleased as the Minister of Health that I'm part of this historic event. This is my first participation in such a conference. And I will cherish it. And may this workshop be more than just an event. May it be a transformative experience that strengthens our health system, empowers our educators, and ensures that every woman and every newborn receives care that is safe and compassionate. Together, we are not only shaping midwifery education, we are shaping the future of our nation. Thank you, and I wish you all productive, inspiring, and rewarding workshop.
Thank you, Mr. Minister, but I was hoping that you would join with me, supporting me in making sure you said to these midwives that, of course, we will support from the Ministry of Health whatever they need to make their work a little easier. You know? What I want to say, you recognize that the minister knows his Bible. Whether or not he searched it when it's this time, for the past times, Mr. Minister, watching you, and it's good about those Hebrew children, and it shows that the effectiveness and how important midwives are. And so I want all the midwives that are here today to feel special. Even though you don't feel special out there, here in here you feel special. And after today and after tomorrow, you'll feel even more special.